everybody. I'm Dr. Johnson.
I'm Dr. Rill.
We're the Chiropractic Johnson Chiropractic here in Catonsville, Maryland. In our previous two videos, we discussed one, the 3 different types of back pain, 2, how do we do the examination evaluation for the different types of back pain, and now we're going to talk about the different types of treatment. So let's talk about the first type, which is typically, we'll say, just a pulled muscle or a soft tissue type injury, Dr. Rill. How do we treat that here?
Yeah, so first, obviously, it comes down to, like Dr. Johnson said, a proper diagnosis, figuring out what tissue is being affected, and then rehabbing that tissue. So for a pulled muscle, things like that, we're going to do some different passive modalities, so maybe some electrical muscle stim, some ice or heat in that area to just kind of relax things, help decrease some inflammation. And then we need to work on, if the muscle is hypertonic, where it's really tight, we need to stretch and help lengthen that muscles. If we find that there's any core weakness or weakness in general, we'll add in some active therapies and rehab to get the patient back to living that active lifestyle.
So why do we like to use ice more than heat typically?
Yeah, for me, typically I'm 90%, I'm always recommending ice. The reason is, heat is good when something is strictly a muscle, right? Pulled hamstring, pulled quad, things like that. It's gonna help relax that muscle, increase some circulation and promote healing. But when we're talking about the spine, we're talking about a lot more than just muscle, right? Like we've talked about, we've got disc material, we've got joint, cartilage, ligaments, so all these different materials. And when you put heat on something, it's gonna relax the muscles, but what it does is it increases that inflammation in the area. Inflammation is what creates pain, right? So especially in the early parts of our treatment plan, when we're trying to help get a patient out of their pain cycle, we're gonna wanna put ice on that area to really help decrease that inflammation.
And the other big thing we do, after we start some of these different treatment modalities, we do the chiropractic adjustment or manipulation to help the spinal bones and joints move better, to improve the biomechanics of the spine so it's less likely to be injured again. When we have what we call a lumbar herniated disc, where the disc material is pushing out, one of the better treatment modalities we use is what's called lumbar decompression. We put a little harness around your waist, pull and stretch. That allows us to open up the disc space between and help suck some of the jelly material back into the space here to remove the nerve pressure, nerve irritation. That should help kind of, again, decrease pain, improve range of motion flexibility, and also, more importantly, help remove some of that pressure on the nerve root that's causing the pain in the back, in the buttocks, down the leg, feet, and toes. When we have someone who's just suffering with spinal arthritis, again, we'll do the ice or heat, but typically more ice than heat. Again, we need to get the spine to kind of move better. So there's when the arthritic changes are there, the vertebrae become stuck. We want to get them unstuck so they move better to help improve range of motion, flexibility. The last piece of the puzzle is we do exercises that are called neuromuscular reeducation. And they're important if they do a couple of things. One, it retrains the nerves in the spine to help modulate pain, but 2, it improves your posture as well. Do you agree?
Yeah, absolutely. And that's a big factor into it, right? We can do all these things to rehab, but if we don't do that neuromuscular re-education, there's a very high likelihood that the patient is going to re-injure their spine because they have abnormal movement patterns, biomechanics, posture, like Dr. Johnson was saying. So it's really important that we address all the aspects of the care plan, going from the beginning where we're in that acute pain stage to the rehabilitation stage where we're preventing future injury.
I like this. So we have one more video coming up, video number 4. We're going to talk about what to do at home if you're suffering with back pain. I'm Dr. Johnson.
I'm Dr. Rill.
We're from Johnson Chiropractic Rehab here in Catonsville.